Welcome to Soft Bites Podcast. Your life, your dentistry. We talk about ways to have more fun and meaning in one of the coolest and most rewarding professions in medicine. Conversations on how to bring awareness, create a healthy workplace, and provide emotional insights to make dentistry a fulfilling activity while making space for one's wonder, creativity, and freedom. Here are your hosts, Manuela and George Andre.
Hello everyone. Hello, George Andre. And hello, Andre.
Hello.
Today we have a special guest with us, Andrea Dagot. Andrea is an oral hygienist, a dental hygienist, and I'm the one going to start, Andrea, to ask you to introduce yourself, because you and George Andre already know each other. So you're also going to tell us how you know each other. So, but tell us a little bit about yourself, why you became a dental hygienist, a little bit about your journey for us to start to meet you a little bit better.
Okay. I went to, dental hygiene actually came accidentally, because I didn't really have an idea for what I wanted to pursue in terms of career. At the time I was 18, I had spent a year improving my grades. We talked about it. I hadn't been a very brilliant high school student.
So what were you doing at 18 instead of taking good grades? Tell us.
What 18 kids do.
Where did you live up until 18?
I lived in Seychelles, Lisbon.
Right.
It's not Lisbon, actually. It's
I didn't know that. I didn't know that you were from Lisbon. I thought that you were from Porto. Okay.
No. I grew up. Well, I was born in Mozambique, but
yeah.
My parents came to Portugal, and I was still a toddler, and I grew up in the south side of the Tejo River, like Margem Sul.
Yeah.
And so I was doing what every 18-year-old do, just trying to enjoy and not really thinking very much about what I was going to do with my life. So at the time, my mom said, "Look, I saw this ad. I don't really remember where, that they had opened applications for the dental hygiene degree at the University of Dentistry in Lisbon." I'm like, okay, I'll try it. Why not? And at the time, dental hygiene was not yet recognized in Portugal as a university degree. It was more of a professional course. So you needed to take different tests. So I went and I applied and I took the tests and I got in. And, it went from there. I really enjoyed. It was tough. It was a tough course.
Andrea, you went for the course without any knowledge of what it could be, if you would like it or not
at all.
But then you enjoyed it.
Yes, I did a lot. And especially because it had nothing to do with, those vocational tests that you take. My mother had me take vocational tests so we could decide what I was going to do. And it had nothing to do with the vocational tests indicators. But I really enjoyed it. And so I decided to stay. Yeah. And it's been good till then. Then I finished my degree in Lisbon, and I came to Porto. That's when I came to Porto to work, because I had a special interest in oral medicine and cancer patients. And at the time, the Oncology Institute in Porto, they were asking for somebody to work as a dental hygienist as a volunteer dental hygienist at the beginning for the stomatology unit. So I decided, yeah, why not? I'm going to try this. I really want to do this. So I came to Porto and worked there for 2 years at the Oncology Institute, and I did some private practice too. After those 2 years, I had a teacher of mine that called me and said, "Look, so there's this degree completion program in the University of Washington, and they have a really nice cancer research facilities. Do you want to go?" I'm like, "Yes, I do." So I applied and I got in, and I spent 1 year in Seattle, Washington, and I did my degree completion program, and then I returned to Porto. But life doesn't go exactly as we want, and at this point, I was already making plans, not like when I was 18, and all the oncology part started to look a little bit impossible, especially due to, all the bureaucracy and, they didn't have any money to hire me at the hospital. And, you cannot live out of air. So I really had to make a choice. And I decided to continue private practice and just, you all the oncology kind of went to this little drawer where I would like to go back someday, but I don't know if that's ever going to get.
Sorry, Andrea. Sorry to interrupt you. So you came to Porto very, very young, and you came alone without knowing anyone, or did you came with someone else? You just started to work in Porto. You came alone?
Well, a little bit. I had friends here, but we were not that much in touch. And the dental hygiene course, it works like this. It used to work. I don't know how it's working now, but it used to work like this. In your final year, you would have this public health part that you would go. You would be assigned to different healthcare centers through the country, and then you would pair and you would do a oral health program. And what happens is, my best friend came in the first semester. She was assigned to Porto in the first semester. And then we switched, and I was assigned in the second semester. So when I decided to come to Porto, she also decided to come to Porto. She was the one that gave me your number and said, "Okay, yeah."
And how was it in the US? How did you find the US? I mean, was it? I mean, of course that you went to the US.
Completely different from the reality of Portugal, right?
Yes, completely different. I mean, I loved it first, I must say. All the university setting and the teaching, their methods, it's completely different, They are very open to teach you, and because they are there to teach you, not to make your life difficult, which sometimes
not to judge you.
Not judging you, yes. And there's always this very natural availability, and that was very, for me, it was good. I loved it. And then I had the opportunity to do other things because they require that you would do other things besides dental hygiene. I had to have credits in, communication and English writing and all that kind of stuff. So I got to do, things like theater. I did stage managing, which was very fun.
I remember you told me that.
Yes, and classes in oral speech and like it was really, really nice. And then the Cancer Institute, it's a whole different world because you focus, you first of all, you can visit your patients in the bedroom and focus the care in to that particular patient. And you get like 2-3 patients to see one morning. And unfortunately, in Portugal, we don't have the means for that. So, you get to the to the service of stomatology. Each stomatologist, they have like 10, 15 patients to see from 8 a.m. to 1 p.m. And that's
crazy.
That's completely crazy. So in the US,
especially when you are dealing with patients so vulnerable emotionally, isn't it?
Yes, and they need more attention. So it's not like, here it looked like a factory. It's not the professional's fault, of course. It's the whole setting. It's the system, the way they have to work like this because they don't have more manpower or better facilities. And that's really bad because they make a really good job with with the sparse resources that they have.
And a few years later, in the north of Portugal, in Porto, you met your husband and you opened a practice, right?
Yes, I opened the practice. We have this practice for about 11 years now. Yeah, and you know how it is. It's hard and it's fun and it's a lot of things at the same time. And then after 9 years working only in my practice, a friend of mine contacted me and said, well, not really only in my practice. I used to help in another practice with the doctor that he was from the Oncology Institute. So he asked me to see, differentiated patients in his practice, like, patients that he had rehabilitated with, patients with no palate and special situations. And then Karina, my best friend, who came to Porto with me, she's like, oh, look, I have this dentist. He's looking for a dental hygienist. Somebody contacted me, but I don't have the time and I don't have the mobility because she doesn't drive. And it was far from her house. And do you want to? It's like, no, I don't have the time. I'm like, no, it's just too much, It's like, okay, who is it? It's like, oh, this person. It's like, oh, okay, now we can talk. So that's
but the reality is that Andrea, she does a favor of spending a day in my practice.
Not really. No, it's nice. I like it. I learn a lot.
Yes, of course. Yeah, but at the end of the day, you didn't have to, and which is very nice.
I think I had to. Actually, I had to because it's
it opens
you just stay there in the same place all the time, and you need to start seeing how other people work.
Yeah, see how other people work. Be in a different team. It's good because it keeps you motivated. Yes, it is.
Yes, for sure. And I also sorry.
Go on. Sorry.
No, I also I think it's important for like I told you, the human aspect. You just deal with different people and try to understand how other people are working outside of your bubble. And it's very important.
Yeah, I agree. It's sometimes that we think that the way that we do things is like the only way, and sometimes just some small nuances and actually this could easily be implemented. It's true. Now,
yes, it's true.
So dental hygienist, and we most of our audience, I think it's Portuguese. I'm not sure, but we have a lot of people from Europe and a lot of people that not a lot, but we have quite a few that listen to us from very different countries. Some of them there is there is the dental hygiene role and the degree is highly differentiated. Like in the US, for example, we know it's like a critical that probably the first contact with a dental practice is through a dental hygienist. Some other countries, they don't even have the degree of dental hygienist. Some countries are just starting. Other countries, like in Portugal, we have dental hygienists, but it's for example, in the north of Portugal, it's very difficult to get to find dental hygienists to work. In the south of Portugal, there seems to be quite an excess. So, and there are many different ways of integrating a dental hygienist in a dental office. What do you think is the role of a dental hygienist, and what do you think it would be the best way to integrate a dental hygienist in the dental office? Let's for example, let's imagine I am a dentist. Okay, I'm a dentist. I have a dental office, and I feel the need for. I feel that my patients, the prevention part is not as it should be. That the maintenance of my treatments is not as it should be, and I'm losing a little bit of control of that. And sometimes I hire a dentist, but they don't actually do a very good job in terms of prevention or maintenance. What would you tell this dentist?
Well, first of all, if he noticed that he's not being able to deal with the prevention part,
right.
he already did half of my job convincing him, because if that is something that it's important to him, I think it's going to be easy for him to understand that he needs someone with differentiated skills, and he needs to bring that person into his practice. He needs to work with that, have strict collaboration with someone who has already the work skills and the how can you say them? I cannot find the English word. Wait, I'm going to try to rephrase this in a different way.
She's differentiated.
Yes, you can call it differentiated. But most of all, I think that person needs to understand that work that he wants to be done, it has to be done by someone who has differentiated formation, and that will definitely create a better revenue for him, not only in terms of costs and how much does it make, but also in terms of the quality of his treatments and the quality of the oral health of his patients. That if we have a differentiated practice, and that is very important in dentistry, we are going furthermore into the differentiated part of dentistry, and we know that nowadays most of the dental offices have, people do aesthetics, people who do dental implants, they have people dedicated to occlusion. So I would for sure make that dentist understand that you need someone to do prevention, and not only to do prevention, but to go with it, follow the patient throughout the whole treatment that you want to make, because it's not only important to prevention. You need to prevent, you need to prepare, and then you need compliance. And most of the times that is the role of the dental hygienist.
And diagnosis many times.
For sure, yes, diagnosis. Look, our profession definition is included like a diagnosis technician. So the dental hygienists have a vital role in diagnosing. dental problems. And when the patient spends more time with us, because that's usually what's going to happen, it's going to be our responsibility, you know, to diagnose situations that are going to happen in our patient's mouth throughout the time, and to refer that patient to the other specialists. Um, Contributions of a dental hygienist um, and the dentists, I think it's important they know they extend beyond patient care. They also are, enhance practice productivity because it helps. Is everything is very well determined that the practice is working efficiently and effectively. Okay, so it's going to help also dentists to focus in more complex treatments. Okay, and that is going to increase, the overall capacity of the clinic, and that's very important. So, being trained to identify those potential treatment needs and communicate them with the dentist is going to be also very important. Okay, and by being present with the patient all the time, hygienists can also, you know, increase patient awareness through the problem, related to their problems, sometimes improve their case acceptance rate because that person is the one that's there with them all the time. You that's the first face that they see. There's the person that goes without the treatment. It's that person that after they finish the treatment is going to do all the maintenance. So it is a figure that it's paramount importance for the dental practice.
Andrea, you mentioned that, and it's true that nowadays dental practices are more and more specialized. But what about what do you think that when you have a small practice, even small practices can benefit from dental hygienists? Because I my opinion is yes. But I think that, and Jorge Andre also mentioned that here in Europe, there are certain countries that the profession of dental hygienist is still or very recent, or they still don't have it, like in France, for example. And I think that in the beginning, and even sometimes maybe in Portugal, I don't know if that's the situation in the north, but in the beginning, what happens is maybe you think, okay, I have a small practice. Why do I need a dental hygienist? Can you elaborate a little bit about this? Because in your opinion, every practice benefits from a dental hygienist.
I agree with you. I think that every practice benefits from a dental hygienist for sure. Um, I think that for many small practices, this is very difficult to understand. Most of all, because most of the times uh, the role of the dental hygienist is very much misunderstood. Um, I noticed that in some of the places that I work on, and it's very underestimated. But I think that in small practices, we are more seen as competition instead of a partner, um, which is exactly our role, being a partner. And if your goal as a small practice is to, grow and develop, um, small practice should think as a dental hygienist as someone that's going to create dynamic, okay, and a different set of eyes to see things in a different manner, and to maybe to create more comfort to patients, more care, more differentiated care. And although that is very difficult here, I can say that here in Portugal, when you go to a small practice, patients are so used to seeing every time the same professional. But if you establish rapport, if you build trust, okay, if you are welcoming, and if you show the patient a positive experience in your appointment, that will definitely benefit the rest of the practice, and that person will understand that she needs to go there, and so that everything just starts fitting and working in a way to develop the practice into a positive.
Andrea, one thing, just a comment and also a question, which is, speaking for myself, one of the biggest mistakes that I made when I opened the practice was, especially in small practice, it's very tempting for the dentist to try to do everything on their own. I'm going to do the hygiene, I'm going to do the endodontics. And one of the first things that usually people delegate is the endodontics, or they call someone else to do the ortho, or they call someone else to do the implants. One of the things that I regret the most, and I really do regret this, is not having, but at the time it was also very difficult in Portugal, but not starting to work with the dental hygienist from scratch. Because I think this is the best case scenario, really, because your practice already grows in a much more structured, much more healthy, and much more patient-centered way. This is what I believe. Because you are not going to do prevention as well as a dental hygienist does. You are not going to do perio as well as a dental hygienist does. Surgical perio, that's one thing, but initial periodontal therapy, you're not going to do it as well as that. So this is one of the things that I would really suggest for anyone starting a practice. Start to find a dental hygienist. I know it's difficult, but it says that even financially it will be much better for everyone. Okay, so that's one thing. Another thing is that, Andre, in your practice, you have a central role, not only because you are the owner, of course, but you have a central role in the way that when someone books for your practice, you do the initial examination of the patient. Can you tell us a little bit how does it work, and what are the advantages of this process?
Well, ideally, so that's our protocol. Ideally, I see the first time, or all the patients that come for first time, except if you are in a pain situation.
Yeah, of course, yeah. But if the patient wants to go for an opinion, wants to start to look, I don't know what I have, I just wanted to just a checkup to see I've just moved into the area, I would like to find a new dentist. Okay, so you are the first contact for a non-urgent care, right?
Yes, I am the first contact. Let me just tell you this. Our practice, it's a small practice. And when we started, and I'm just saying this, going back to what you were saying when you started, that you would like to have started with a dental hygienist, and that temptation that you have to do everything. And when we started, we had picked up this practice that it was in dying, let's say, because the dentists that owned it also died, so the patients left, and we had very little patients, and we only had one dentist working there, and she would do most of the work. We had an orthodontist that would go there occasionally, and from the start we decided, okay, it's going to be like this. And we didn't have many patients, but we we started our practice like this. It has to go to the dental hygienist. People are not used to this. We are, we are in the very beginning. We have to pull this out. But okay, let's do it this way. And it worked, you know. Sometimes that fear that people have, like, oh, I'm going to put a dental hygienist and I'm not going to have work, or oh, I can do this. No, I don't need that. But it worked because what's going to happen in that first appointment, as you well know, because you have a first appointment and an initial exam in your clinic, is you're going to, first of all, address all the patient needs. You're going to understand that person. And what it's going to happen is when you make the diagnosis, you're going to establish a very well-defined treatment plan. Of course, I'm not going to define the treatment plan by my own, of course, but some issues I know that, okay, this I can refer now, okay, and we can actually start treating this patient in a differentiated way. So that for me, it's very much important for for how do you want to build your practice and how you want to treat your patients, and how do you want to be seen as a professional? How much do you care about these patients? And if you care for them, you want to give them the best treatment possible. And having very well defined roles in your team, I think that it's a good path to the best treatment possible.
Another thing, dental hygienist has a lot to do with communication skills, with changing behaviors in other people. And yeah, well, if it's possible, right? But one of the things that I really, one of the things that, this is what I feel, and then of course you will tell me the way that you deal with patients, because you have a lot of experience in this area. I mean, you've been working as a dental hygienist for many years, and you know what works, what doesn't work, what's the style of I mean, each professional, each clinician has its own style, right? But the prevention and because at the end of the day, what we are talking here is one of the things that I think it's really growing a lot, which is lifestyle medicine. This is what you are dealing with, right? You are trying to improve.
The holistic.
Absolutely, you are trying to
approach.
Improve. Yeah, because one of the things that I know that you do, for example, you are very attentive to systemic health and medication that the patient is taking, because that has a huge influence on periodontal health and so on. But at the end of the day, what you are trying to do is to do the most difficult medicine of all, which is lifestyle medicine, which is growing a lot. And in order to do that, it's not linear. It's not linear. It's not just like you write the recipe, just do more exercise, or just brush your teeth, or just use this. I mean, it's much more complex, because there's a human involved, and it's really difficult. One of the things that I feel about whenever I give oral hygiene instructions to someone is I feel that I am doing the right thing, in a genuine way, where there is no financial outcome directly. I mean, it's not like I am selling a crown. It's not like I am selling an implant. It's just like what I am selling him is a lifestyle change, and he doesn't have to pay anything for me. And I think that patients feel that. This is what I feel. I feel that patients feel that, look, there was someone here that took their time in order for me to explain something that is not going to directly give them money. And I think that patients are very sensitive to that, right? This is one of the things that I see. But in terms of lifestyle changes, I mean, and it's all very complex, of course. What does your experience tell you? What do you think that works? What doesn't work? And how do you approach these patients? What is your approach?
Well, it's like you just said, it's everybody's so different, and this is so hard nowadays because especially people have great expectations, and they're very mindset when it comes to something to their beliefs. But um, most of all, it comes to motivation and communication and compliance. And how do I get there? I think it's about everything. You need to, look at the person that is sitting in your chair, um, understand their needs, their fears, and, you know, overall evaluate, look at let's say the holistic side of things. You need to look at everything, you know, not only that deal with the health issues, if they take any medications, if they work out, what kind of diets do they have, but you need to also understand how that life, how do people live, how is their work schedule, because it might not look important, but it is important, because if that person works in shifts, you need to adjust your instructions. You need to adjust um, what kind of products you're going to ask them to use. You need to understand, do they work out of the house? Do they work in the house? Do they travel a lot? All those little things about evaluating the person and the person that is in front of you, it's important so you can achieve that good communication and compliance. Of course, that it's not going to work every time, or it's not going to work the first time, especially because we all know that patients get all very excited in the first month, and then everything goes down the drain, right? And that means that, like we have talked before, that means that every time that patient comes to your appointment, you need to adjust, to the reality of the moment and to what that person decided um, to do and to bet on what you have taught them to do, and try to evaluate how much did they took with them and how much they did. And how can you adjust every day? How can you do better? How can you make them feel less overloaded with everything that they have to do? 'Cause that's another issue is, I believe you cannot overload people when it comes to all the motivation, because nowadays everybody has so many things to do, everybody has so many things in hand, and social life and the working life and children and this and that. So I don't want to create an overload for that person. I want to simplify their lives. And all these little issues are issues that are important for us as professionals to be aware of that, and adjust every time. I don't think there's a straightforward answer for that.
The other time that we talked to you, you said something that stuck with me. You said progression over perfection, right?
Yes, right. Progression over perfection, because you are not perfect and your patients are not perfect. So you're not going to achieve perfection ever. I don't think you are. So I think that you need to follow the person and help her progress, even if it's just small things, okay? But every small thing is progression, and eventually you will get to that point that you get very close to perfection with some patients. Then you have other patients that you cannot reach them by any means, and then you get desperate with that. But I believe that somewhere in between, even that person progresses even a little bit. Maybe they don't brush twice, but they brush once. Sometimes they didn't even brush. So that is progress in a way.
And Andrea, and for what you for when I listen to you talking, I can see clearly that you the dentistry that you practice and that you believe in is this holistic dentistry, and that your job and the job as a dental hygienist is a doorway for that. So, and we know that, gum disease has been associated with a range of health conditions, heart disease, diabetes. Tell us a little bit about that, about how the research on oral hygiene and dental prevention, what the research tells us about the overall health. Because I really do think that this is a big doorway for people to start understanding their dental and their oral health, crucial to their overall health. And I, for what I understand, when I hear you talking, you believe in that also, and you believe in this holistic dentistry, right? You treat people, not only teeth.
Yes, it's so important. There's this thing that I usually say to my patients. It's like, this, you didn't bought it in the supermarket. This comes with everything, right? So this is part of you. It's not something that you just can, take off and go and grab a new one and that everything is fine. So it's being part of your body. It's very the oral health is very intricated with your general health, and I try to explain that to patients. Obviously, that the research is actually showing us nowadays, and getting more and more proof of something that we actually already knew, or we thought we knew, that our oral health status influences your general health, and vice versa, because there's this, for example, in diabetes, you have this double influence, right? You have you have oral health issues that are not controlled. Your diabetes, it's more difficult to control, but also if you don't have your diabetes controlled, it's more easy to have oral health issues, and especially the development of in a rapid pace of situations like periodontitis. So that's obviously something that it's being continually studied, and the research shows us that all this is associated, okay? And also, more important nowadays, although the cardiovascular association between periodontitis and cardiovascular disease, although the character of the association is still under debate, there is obviously shared risk factors, and it's not even confirmed yet, but there are studies that show you that periodontitis itself may be a risk factor for cardiovascular disease. So it is very important to explain this to patients. And what I noticed is there are more and more people concerned about their overall health. So that makes them more concerned, also more preoccupied, and um, with their oral health, which is good because there's um, this gap, this frontier that was so hard to pass, and it was so hard to explain to people. And now, even the research has been more open to the general population. So people are more open also to treat uh, their oral health because they're worried about general health. And I think that in the future, all this research is going to definitely point us to, the way of how can we do better in oral hygiene and dentistry to achieve better general health. Definitely. For now, we know that it's have good oral hygiene and especially controlled. If you have installed periodontitis, at least you have controlled your disease. And so I think that's the way we are heading.
All right, Andrea. There are several different models of the way that you would schedule for a dental hygienist. And I remember that I had this debate, and this is something that we thought about and how you would integrate in a practice. So a couple of options. One way would be patient would go for initial examination with you, then they would see the dentist, and then the with you or a dental hygienist, and then they would book every 6 months, every 4 months, or wherever for a dental hygienist. And whenever there was an issue, then it was referred for the dentist. That would be one model. Another model would be, okay, so the patient is split between the hygienist and the dentist. Like in 6 months, they go to the hygienist. In 6 months, they don't go to the dentist. This is something that in the beginning, I thought it would make sense. But then today I have to what I think about this is that this doesn't work very well if the patient goes to the dentist to also do an oral hygiene, because it's not going to be the same way. Some colleagues, they do, the patient comes every 6 months to the dental hygienist and every 6 months for the dentist just to check occlusion or some sort of rehabilitation. Other practices, the patient is always booked for the control appointments for the dental hygienist. And while the dental hygienist is there, then the dentist just goes and checks if anything is needed, much similar to the American model. So, I mean, there are several different models that you can schedule for the dental hygienist. What do you think works best for you, and why do you do that?
Whenever you made me that question, it was a concern of you years when we started.
Sorry to interrupt you. Exactly. This was one of the concerns for myself, because we were like, okay, so for the new patients, this is going to be easy, but for the existing patients, how are we going to do the transition? And one of the things that I was thinking was, okay, so we should book like one appointment for the dentist that the patient is used to do the oral hygiene, and then another appointment for the hygienist, and they would basically switch every 6 months. The problem with that is that the quality of the oral hygiene from the hygienist is like 10 times better than the dentist, right? So then it creates an issue in a practice. I mean, I come here to do a cleaning, but I'm used to do it with the dental hygienist, and she does a much better job than you, right? It's not like the patient does not want to be seen by the dentist, but they understand that the quality of the hygiene it's much more differentiated because because the professional is much more aware of what they are doing. They know exactly what they are doing, right? And they do a much better job. They probably hurt less the patient. They know exactly what to do, where to do, right? So that was a concern for me. And in the beginning, I said, well, patients will not like to be just to be completely thrown to the hygienist, right? And so this is why it's so important to have a coordinated team and to look at the hygienist as someone that can actually be increasing the trust of the patient in the whole practice, rather than being someone that just does cleaning, which is a completely different story. And today, I think, but you tell us your opinion, Andrea.
Okay. Well, my opinion is exactly what I've shared with you before, that I think that there's not a magic pill here. So it's not like, oh, take this and it's, it works every time. I think every practice is different, and every professional, every dental professional has different expectations when it comes to the dental hygiene role in the clinic, and has different issues to deal with. So I think that everyone should evaluate first and see what really works for them for their practice. And then something that should always be discussed with all of the dental professionals in the practice, and also the dental hygienist, of course. In my opinion, in what I have experienced, it's more difficult to implement a dental hygiene appointment, and with all patients, people that have been used to a different kind of consultation dynamic, right? Appointments are different with the dental hygienist, but I think that it's something that you can implement very slowly, and you can start in one way and then shift it, because the shift in determinant time, because the patient is also getting more used to the dental hygienist. Because in my opinion, the perfect setting would be that the controls would be made by the dental hygienist. Because when you focus that the patient has to go to the dentist, most of all, what we do is, if we have any findings, and we are there not only to do cleanings, we are there to make constant evaluation. We are there to make constant diagnose. We do x-rays, we do scans, and if there's any problem, the patient is obviously referred to the dentist. So I don't think that the patients lose anything with this. Much to the contrary, we gain, And I have a lot of patients that actually really like this model, because they're like, oh, thank God I don't have to go to the dentist. That means everything's okay. And, and that's also a motivation, because, I tell them everything is okay. You don't have to go now. I'll see you in 6 months. And they're like, oh, I'm going to continue to do this the way I'm doing, because for them it's good. It's working. They don't have anything else to deal with, just come for the control appointments. So yes, I think that that's something that you can achieve over time, definitely. But in my opinion, that's what it works better. And that's not going to take or steal any work for the dentist, because there are always new patients, and those patients eventually, in time, will also have other things to do. Sometimes these patients have other treatments that they are not willing to do in the beginning, and then everything is just going so well that they feel motivated, and then they're like, oh, remember when you talked to me about putting the braces, do you think I should do orthodontics? Yeah, I think it's a time. And there's always this dynamic that the patient is it's more comfortable, because they're very motivated, like, oh, I everything seems so fine. Obviously that this is not like this 100% of the time. That would be wonderful, but it does happen a lot, and I have very much this experience. And of course, this is something that you build with time. Yes, in the beginning, definitely, if it works for your practice, that um, those appointments are, divided between the dentist and the dental hygienist. Why not? Well, I think everybody should do what works for them and for their patients.
Andrea, how do you see the role of dental hygiene in dentistry? I think it'll have a more and more important role, but also in digital technologies and dentistry. How do you think it's going to be the future?
I don't know, especially because I'm those kind of people that it's called info excluded.
You are?
But I try hard. I really do. But I think that the new technologies can be very helpful for the dental hygiene profession, and I try to use them, and I use a lot of dental photography. I try to take pictures of my patients, the before and the after. I try to do good dental photography. Of course, I'm not at my highest where I should be, but I'll get there. And I've been using also the dental scan, which I think it's going to be a very, very helpful tool. For example, it's just a few examples for the dental hygienist and the dental hygiene appointment, because you can, it's with these tools, you can use them to show patients the reality of their oral health. And people, they like everything that it's graphic, right? They like to see you. You're not going to say, "Oh, you have calculus on your left molar and upper left molar." Like, they don't really see that. Oh, your gum is bleeding and it's swollen. And if you have pictures, and if you have a scan, a digital scan, I think those are very, very good tools that you can actually start using for the dental hygiene appointments. And it's something that we've been discussing. I honestly don't know if that is something that it's being done in other practices. I'm pretty sure that might happen. But in my practice, then is, okay, let's use the 3D scans for, like a periodontogram, so we can compare the first appointment, and then after all the non-surgical periodontal treatment, and you do the before and after, and the patient can see the real changes that happen in the course of the treatment. So yes, those technologies are definitely going to grow, I think, in the dental hygiene appointment. I hope so. Well, I think we cannot be stuck to, the basics.
Okay, Andrea. Just to wrap this up, we know you have a course. I'm actually a part of that. But so after many years outside teaching, because you taught for many years in undergraduate,
a couple
right?
of years.
Couple of years, yeah. Okay. So, but you taught undergraduates. But now
Yes.
you have decided to share your knowledge at a postgraduate level with a private course, right? Can you tell us a little bit about how that came up and what is the goal with the course?
Okay. That came out. One of the people that instigated me to do this, it was you, and because you invited me to give a lecture on your course, your Prosto course, and also Andrea, the owner of the practice where we're going to teach the course, she had already contacted me, and she said she had been in this for a while, and I think I felt like I needed to do something different. It's like when I decided to go and work with you, I didn't want it to be stuck um, doing all all day, every day, the same things. It's not like it's boring. It's not boring. I love what I do. I love my practice, but I I really like to try new things. Um, and although I always try them scared to death, but I do it anyway. And one of the main reasons why I decided to do this is because there are not many postgrad uh, continuing education courses here in Portugal for dental hygienists. And you have in Lisbon 2 or 3 courses, and they're not. This one is set in a different way. It's set in modules. There's a continuous one. You can do the course from the beginning to the end, all the 3 modules, and it's all very well engaged. But it's also good because you can do it separately. You can do each module in a separate way. So you can do one module this year, and next year, if you want to do, you can do the other module. And it's set up to work in the same way. Um, Especially because professional development for dental hygienists is very important, and like that, if you want to do something more high high standard, or it's not like high standard with different standards, you need to look abroad. We have so little resources here in Portugal, and I really wanted to, help in the growth of these resources. So, dental hygienists in Portugal can have more options. Plus, the problem is most of the courses are in Lisbon, and we have dental hygienists up north. We will want to they that they have the possibility to have a course here in the north.
All right, all right.
And they leave the contacts. Where can the ones that are listening to us find you and know more about the course?
Oh, well, the claim is How to Dental Hygienist 2.0. And there's a page, the official page in Instagram, which is managed by our dear Isabel. And she can answer to your questions. You just send a message and she'll answer. You can also find me in my Instagram, Andrea Dagot, and approach me and with questions of the course. I'll be very glad to help you with that. And you can also check all the course program at sorrisonatural.com. They have all the layout and the course program with everything you need to know.
Okay, perfect. I will put everything on the show notes, all your contacts and all
Andrea,
the links.
where does your English come from? Was it from the year in the US, or was it before?
It was before, and it was the year in the US, because my parents, they used to work abroad with non-Portuguese speaking people. So I had to learn English at the very early
this perfect neutral English accent, not British, not American, just spot on.
Yeah.
Thank you.
It's true. Thank you, Andrea, for your time.
Andrea.
Thank you. And thank you everyone for listening. And we'll see you on the next episode of Soft Bites. Thank you. Thank you for listening to the Soft Bites podcast. We would love to hear your thoughts on this episode. Please leave a comment or connect with us on social media. Your comments and messages will help us to know you and our profession a little bit better so that we can offer real value in return. And if you like it, please subscribe. If you want to learn how to be a leader and drive change in dentistry, take a look at our Conscience Leadership course at softbites.online.